Individuals behind me, and I had a chance to speak to people who've traveled here. I want to thank them for coming as far and wide as Texas and North Carolina and Virginia and Walter Reed in Maryland. Yes, ladies and gentlemen, these are the military. These are the DOT teams that I asked for help from President Biden. I was with him yesterday. I've talked to him many times, my weekly conversations with the White House on dealing with COVID, and I wanted to thank him, but also thank him for sending the help from Walter Reed, Fort Belvoir, as well as the 1st Medical Brigade out of Fort Hood in Texas. And they are here because we needed them. We needed them to help us get the relief that our overstress, overwork, healthcare personnel have been enduring for such a long time. So we're so happy they've joined us. Captain Elizabeth, Heisenga? Say it again.
Heisenga.
Okay, everybody mangles my name, so I'm going to get yours right. Heisenga, okay, and you'll be hearing from her on what her responsibility is and how happy we are. But right now we have 20 personnel, physicians, nurses, respiratory technicians who are all here right now, and I'm so thankful for them. As we talked to President Biden many times, and he said, Kathy, what do you need? I said, I need bodies. I need people to supplement the people who are in there right now, and so he has sent over 71 total personnel between 3 military teams. They are as far and wide as ECMC in Buffalo, New York, to Coney Island, to right here in North Central Bronx. And we have more teams approved, 4 more teams approved for upstate Strong Memorial in Rochester, as well as Syracuse, areas that are still being hit so hard by this pandemic. So in all, I mean, think about the scale of this. They could have gone anywhere in the country. Welcome, Congressman.
Thank you.
All set with the traffic out there? Got it under control? All right, we're glad to see you. Cross Bronx, a little tricky. Let's talk about that next. So right now we have over 110 federally provided ambulance units. These ambulance units are incredible, particularly areas where there are not a lot of hospitals can congregate together, areas of upstate New York. When someone needs to be transported because they have lack of capacity, lack of personnel, it is hard to get someone to another hospital, whether they are in Watertown, they need to go to Syracuse, or anywhere. This has been a real challenge, so we have been so reliant on them to give us the extra support we need. So we have 110 federally provided ambulance units, as well as 225, and I'm so proud of them, National Guard members who've been deployed. As I mentioned, we're also making sure that they have some medical training so they can be even more helpful when they show up. So thank you, President Biden, for all you've done. As we talk about what we just came through, literally approaching the 2-year mark, we already had an overburdened healthcare system. We truly already had this. This was not a new phenomenon. And if you look at the numbers, the studies that were done in the past, they already showed back in 2018 that on the path we are on, that we'd be short about 32% of the healthcare needs that would not go unmet because we'd have a staffing crisis. So take that dynamic, that trajectory we're already on, put layer a pandemic on top of it, and an overburdened situation has now spiraled out of control. So this is an area that needs major investment. We have to rebuild our health care, supporting our workers and anticipating the future. And that is what you see in my budget. That is what we've talked about. That is where a lot of our conversations have been with the health care representatives here. And again, 2 factors here: the exhaustion, the fatigue, what they've seen, these workers who've been here, loss of colleagues, and those, despite their training, the almost insurmountable number of people who came in and lost their lives. That touches you. That has an effect on you. And yes, they're strong, they're incredible individuals, but they're also human beings. And this has been really tough on them, and we need to acknowledge that. We need to continue to acknowledge that. And we already had, as I said, pre-existing staffing shortages. So I want people to know that we are taking this very seriously. And we have to make sure that we understand that everyone deserves access to quality health care. That is a basic human right that we're putting an exclamation point on. And we must prepare for what the future throws at us. So how do we do that? I laid this out in my budget just a couple of weeks ago. We are making the largest investment in healthcare, the healthcare industry in our state's history, $10 billion. $10 billion to help support and sustain this industry. Support the people, the places, the industries on the front line hit the hardest. And we also have a plan, a very ambitious plan, but we've talked about this for a long time. We need to grow, literally grow the healthcare workforce over 20% in the next 5 years. So that's our goal, and again, we're going to achieve that with working with our great partners. How do we do that? First of all, we have to stop the hemorrhaging of current healthcare workers. They're still leaving. And how we do that, we say, we're not just going to say we owe you a debt of gratitude, as nice as that sounds. We also have to pay you the debt we owe. And we are investing over $4 billion in bonuses and wages for our healthcare workers, as well as retention bonuses of up to $3,000 for our direct care workers and our healthcare workers as well. That means right here in North Central Bronx, we'll be able to have a payment of $3,000 to qualified frontline individuals making less than $100,000. Also, we need to bring more people into our ecosystem, and there are doctors and nurses in other states who could come here, but there's many bureaucratic barriers to that. So we're going to make it easier for them to come here, make their homes here, and use their existing licenses. Expanding capacity in our medical institution where the training occurs. We have to bring more students in, help support their education financially, free tuition, stipends, and get them to remain here after they graduate, as well as rebuilding our healthcare institutions, the hospitals, the nursing homes, the medical facilities that were just crushed by this pandemic. So we announced another $1.6 billion for the actual facilities that need the money, and they need it now to start rebuilding back. So that's what this is all about, is to show, yes, we need your help today. We hope to be more independent next time because we're going to rebuild this workforce, make it stronger, make it more resilient to any other healthcare crises that come our way. We need to have more people in the system as well as supporting our existing institutions. So it's still winter outside. Those of you from down south are talking about their first experience with the snow. They're doing just fine. I offered to teach them how to make some snowballs. I'm pretty good at that. So we'll have some fun. It's actually fun to be in the snow. We'll try to convince you of that. What have we done? We talked about the winter surge. This was not a surprise. We saw the global trends. We saw what was happening as far away as South Africa, that spike that went up so quickly. And so back in early October, we started preparing for the winter surge. And what did we do? We talked about making vaccines more available, getting the boosters out to people, supporting our healthcare systems, and the efforts are paying off because we made sure that institutions like nursing homes and schools and other places have testing kits and masks. You've heard me talk about this for months. And now it is paying off. We saw the numbers go up rapidly. You all know that before we even had our first case here, November 26th, I declared a state of emergency to give me the flexibility I needed to be able to make the surge and flex decisions with hospitals, make sure they could manage their workflow and the patient care, as well as making sure we had all the legal rights to take steps we needed to keep New Yorkers safe, which has been my #1 priority since day one, keeping New Yorkers safe. So we supported everybody, and let's talk about where we actually are. We anticipated the surge came, and now it's starting to go away. Just like the snow is melting, we hope that this winter surge is also melting away as well. So look at those numbers. That is a beautiful sight, my friends. We have been waiting for this. It is hard to believe that on January 7th, we had 90,000 positive cases in our state. Today, 1st of February, 7,119. That's an extraordinary drop. That's a 92% drop from our peak of 3 weeks ago. And yesterday in New York City, hardest hit, first wave, second wave, Omicron wave, and look where they are today. We had 2,639 cases in New York City yesterday, and in the Bronx, 303. That's 303 too many. We're going to get to a point where we don't have to talk about even that many cases, but look at the progress we're making statewide, and again, that is just extraordinary. Positivity is going down. 7-day average of 5.9%, almost 6, but that's a 17.25 drop, 17-point drop, not a percent, 17-point drop from our peak of 23% just on January 2nd. So our infection rate in New York City, about 4%. The Bronx, yay Bronx, 3.7. Let's give the Bronx cheer for that one. I like the sound of that. And a 7-day infection rate continues to drop as well. So there we go. Hospitalizations. We're in a hospital. My greatest stressor has been vaccines, yes. Getting enough people vaccinated, yes. What is going on in the hospitals? And so our hospitals, we've been watching very closely. The good news, the hospitalizations continue to drop. And yesterday, as I mentioned, hospitalizations are 7,100. That's a 43% drop in hospitalizations. So hospitalizations are a lagging indicator. We've talked about this from the beginning. First you get the infections, then people get sick. If they're really sick, they're going into a hospital. And look at this, the numbers are starting to trend downward. And even the North Country that looks like a little spike, that is literally the difference between 25 people and 21 people. So these are minor numbers. We'll be able to handle that as well. So our hospitalizations are about 3,000 here in New York City. The Bronx, 477 people are in the hospital. And we did lose. We're still losing New Yorkers. So infection, illness, hospitalization, and sadly, in far too many cases, people are still succumbing to this. 122 deaths yesterday. We wanted to make sure we keep those individuals and their families who are suffering in our hearts and prayers. So the numbers are trending down. We're still going to take this seriously, though. This is not saying it's over. You still compare to where we were December 1st. Look at December 1st. Have a little ways to go from where we had before we had our first case. But again, the hospital admissions, those are beautiful sights to me as well. Look at how we've declined so rapidly in our hospital admissions. Fewer people in hospitals, people getting out with their lives. Self-resolving at home, a lot of people are experiencing symptoms, but they're back home, they'll be back to work, back to school in a short time. So I still want more New Yorkers to get that second dose. 95% plus, and then that's as high as the CDC keeps track of, so I'm going to guess we're a little higher than that even. But let's finish the series. Just get it done. But look at the numbers for children. And as we talk about what the future is going to bring for the school year, et cetera, we're focused on the fact that those numbers, as much as they're going upwards, are not where they should be. They're nowhere close to what they should be. And the good news is Pfizer is making great progress on getting a vaccine to the FDA for approval, possibly by the end of this month, for children under the age of 5. But why don't we just take care of the 5 to 11-year-olds first? I mean, their older siblings are getting vaccinated. We know it's safe. Tens of thousands of people, hundreds of thousands of parents have agreed that this is a good thing for their children. So we're going to continue our promotions, make sure that there's whatever incentives kids need to have, ski packages, family incentive, pop-up vaccination sites. We'll keep it all going. But right now we're taking 2 actions to remove barriers for parents to get support. And one of them, in early December, President Biden required Medicaid to cover COVID vaccine counseling visits. What's that all about? Well, in order for to be reimbursement for a doctor to talk to someone, they have to have a box you can check and say that is a covered activity. And so they required Medicaid to cover the counseling visits, regardless of whether it ends up in the outcome of a child getting a vaccine. We believe that this should be extended to all insurers, not just for people who are covered by Medicaid, but for all families. So we're calling on the federal government to issue guidance so all insurers can cover COVID vaccination consultations for families and children. Also, the insurance companies should be covering the incentives. I mean, help the doctors, help the medical professionals, offer incentives to families and for children to do this. Department of Financial Services will offer guidance on this. They offer all kinds of wellness incentives. I mean, you get incentives to go join a gym, for example, or eat healthy, or go to certain restaurants. Let's get them being creative to help create incentives for this so we can get over that hump, get those last group of kids vaccinated so we can make sure that they're safe in schools and wherever they go. So we're targeting, we're going to be talking to our primary care doctors about this as well. All right, boosters. This is good news as well. Look how high they are. We have almost 6 million people boosted already. People who are eligible, what are you waiting for? This is the extra security blanket you can wrap yourself in and say, no matter what happens, I'm protected. And if I do get it, the symptoms are so much more minor than they would have been had you not been boosted. So that's great news. Also, you hear a lot about this phrase, long COVID now. This is an institution that is studying it. We're proud of the work that's being done here, and as well as by Dr. Katz in New York City Health and Hospitals. They are creating they have COVID centers of excellence. They're the first public facility in the nation to be addressing long COVID needs. But I've been asking my health team for a couple of weeks now, a couple months actually, to get us real data on this. What does long COVID mean? Is there a difference in individuals who are actually very sick with COVID and they're more likely to have long-term symptoms? Or can someone who just tested positive didn't experience real symptoms but may have some lingering health effects. And we have to make sure insurance companies are going to cover this into the future as well. So we know that there's very strong physical, mental, emotional, and actually psychological symptoms associated with this. And we want people to take this seriously. So therefore, I've asked my Commissioner of Health, Dr. Mary Bassett, to convene a panel with experts from all around to assess this, spend the day Thursday the 3rd from 8:45 to 2:30 examining this. It'll be open to the public. It's a free virtual event. It'll be on DOH's website. But doctors, people who are experiencing long COVID, let's talk to them about what's going on. And our goal is to gather information, analyze it, find out treatments, and give people hope. Because there's nothing more disturbing to someone than to have gone through COVID and feel that you're through the whole worst experience of it. You recovered, but the symptoms are lingering, whether it's cardiovascular, whether you're exhausted, difficulty concentrating. And we need medical professionals to treat this seriously and understand ways that we can start giving us ideas on how we can treat this. So let's address that as well. So we believe we're finally turning the corner on the winter wave. Just like the snow is melting, hopefully these numbers will continue to melt away, and we're going to continue preparing, though, for whatever the future brings. That is our responsibility. Always prepare for the worst and be happy when it's not that bad, just like you prepare for a big snowstorm. It's all about what you do to prepare. So, and again, building back the ranks of our workforce, critically important, strengthening the entirety of our healthcare system, so we are never again as vulnerable as we are right now. And as much as we love having our visitors from the Department of Defense and all over bringing their talents and their passion to give just a little bit of relief to our hardworking medical professionals, it'd be nice if we didn't have to do that. And we look forward to finding the day we get through this, get to the other side of this, and just as feels like spring's around the corner, it feels like the COVID winter is starting to melt away as well. So we're going to continue leading the fight. We have the tools. We're going to keep things open as we always have. The whole objective to everything we put in place, vaccination requirements, masking, et cetera, was all for the dual purpose of keeping people healthy, but also keeping our schools open, keeping our businesses open, keeping our lives once again being as normal as possible, and that's what we've been able to achieve through this. So, so thank you, everybody. And with that, I'll bring back our Dr. Say it again, Captain Elizabeth Heisenga, Captain Heisenga, who hails from Fort Hood. Okay, let's find out from someone who actually does this and is using her medical talents to lead an incredible team who are here. Again, as I said, the cavalry has arrived. This is it's a gift to all of us. And I had a chance to speak to all of them, and I just wanted to thank them personally on behalf of all New Yorkers who are benefiting from their experience and their desire to serve. These are true public servants. Captain?
Good morning. I'm U.S. Army Captain Elizabeth Heisenga, an emergency room nurse and the officer in charge of the military medical team here today. My team and I, part of the Department of Defense's support to the Federal Emergency Management Agency and the whole of government response to the COVID-19 pandemic, are here at New York City Health and Hospital at North Central Bronx at the request of the state of New York and in response to the latest surge in coronavirus cases throughout the borough. Since our arrival last week, NCB hospital staff have gone above and beyond for a seamless integration. We are very appreciative of their efforts and feel like a part of the team. My soldiers are active duty military doctors, nurses, medics, and respiratory therapists that come from a variety of military installations from across the nation, bringing with them an overabundance of medical experience and knowledge. Our attitude and expertise, coupled with that of the NCB hospital staff, will prove invaluable as we work together to tackle the rise in hospitalizations from the coronavirus. While the duration of the federal military assistance here will be determined by an ever-evolving situation, our team will help for as long as we are requested by FEMA to support the state. To move ever upward, as the state motto suggests, is our commitment, as we continue to partner with civilian healthcare professionals to relieve pressure on the hospitals and alleviate suffering. Thank you. I will be followed by Congressman Adriano Espaillat.
Pronounced it right.
Thank you, sir.
She pronounced my name right. Thank you, Captain, and thank you, Governor, for your great work, and of course, thank you to the team, the medical team here. This is sort of like the epicenter of the pandemic. You know, this week we'll have a minute of silence for the 900,000 Americans that we've lost in the pandemic. Almost 1 million people have died in this pandemic. And I remember back in February, 2 years ago, February, March, April, we would have every Wednesday evening, we would have a call where Dr. O and Ms. Quinones, who used to be the head of the of this hospital, and Hoffman Hospital Corporations, and New York Presbyterian, and Montefiore, and Harlem Hospital, they would call in, and they would give us the numbers. And these zip codes here in the Bronx were like, we were getting hammered right here. This was really bad. And we were able to successfully work with Dr. O and put up a testing site right by Lehman College in the parking lot there and begin to test. And Councilmember Dinowitz was helpful, and our board president, Vanessa Gibson, was helpful. And so this is a neighborhood that really felt the pandemic. We were like in new ground. So you are now the folks that are coming in to help out, because this is still very much among us, and we're sort of like learning every day how to deal with it. But these zip codes and the workers from 1199, heroes, they were out there in the front line exposing themselves. Some of them died. That's how difficult this all was and is. And so we thank you for coming to the Bronx. The West Bronx was particularly hit hard. The entire West Bronx border and the zip codes there were particularly, if you look at the numbers, really bad numbers. And so we need to work. This healthcare industry is not only just important to the borough of the Bronx because of the services that it provides, but it's also the biggest employer of the Bronx. So it's important to our economy as well. And so we thank you so much for stepping forward and providing the help that we need to save lives and to really help us hold our hands and help us going through a new era, the post-COVID era. We don't know. This is new ground, so we need to work together to ensure that we move forward together. Gracias a la gobernadora, a la capitana, por estar con nosotros, los líderes, el doctor O, George Priestley de la 1199, el concejal, la presidenta del condado, los líderes de la corporación de hospitales de la ciudad de Nueva York y naturalmente los soldados que vienen aquí a ayudar a nuestra comunidad a cruzar por este periodo de una pandemia, ayudándonos diariamente a salvar vidas. Thank you so much, all of you, and keep the faith. And now with that, I would like to introduce to you brand new, really brand new Bronx Borough President, Vanessa Gibson.
Who's counting? I'm only in week 5, but who's counting? Good morning, everyone. Thank you so much, and welcome to North Central Bronx Hospital. I am so honored to serve as the Bronx Borough President, and I want to first acknowledge and thank each and every one of you for being here today. It's a very important reason why we are here, to continue to affirm our commitment to caring for all New Yorkers, to make sure that we invest in our healthcare workforce, and at the end of the day, to make sure that we do everything possible to protect and save lives. I want to acknowledge our president, Joe Biden. President Biden has been an amazing leader. He has worked around the clock to never forget New York. And our governor, Kathy Hochul. Governor Hochul has been a friend to the Bronx. She is here all the time, checking in on us to make sure that our borough is safe and we are good. Certainly the horrific fire that we faced on January 9th that claimed the lives of 17 neighbors has reminded us of the work that is done every single day. And I want to thank you, Governor Hochul, for your support, for lending your office and your staff, being amenable to conversations as we move this borough forward. So many have been involved, our healthcare heroes and sheroes every day. I'm so grateful for Dr. Mastromano, our president and CEO of Jacoby and North Central, Dr. Jones. It's good to see George Gresham, our partners at 1199, and Ms. Pat Kane from the New York State Nurses Association, and really all of my colleagues in government. It's good to see you, Dr. Mitchell Katz, our president of Health and Hospitals, and thank you, Captain. Thank you so much for assembling this incredible team, the U.S. Department of Defense and the military team that is assembled here today affirms our partnership as we move forward. We know that COVID-19 and the impact that it has had on this country. The Bronx faced one of the highest death rates due to COVID-19. Many of our residents every day live with underlying health conditions and health disparities that we have faced for many, many years. And we are no stranger to struggle and hard work. But through it all, through dedicated teams like the military team assembled here, who are dedicating their time and their labor to come here to North Central to provide services and relieve the burden on our medical staff, our nurses and our doctors and respiratory therapists. We are so grateful that they have traveled from near and far to come here to North Central to provide the medical expertise and the support and the continuity of care with diverse and language access that so many of our residents and families here in the Bronx rightfully deserve. And as we continue to tackle COVID-19, we're grateful when you hear the numbers, the positivity rate is going down. There was a time for us in the Bronx, many of our neighborhoods were well into the 30s in terms of the positivity rates. And now we're in single digits. That is a sign of progress and hope for a better tomorrow. But we cannot rest. While we see these numbers, we are not satisfied until those numbers get down to zero, where we'd have no longer cases of COVID-19. And so it means our work is not done. It means we still have to collaborate and make sure that we have the convenience of testing sites and vaccines and booster shots. We're continuing to be creative and meeting residents where they are, going into schools and community centers, working with clergy and faith-based leaders, and so many of our partners, our FQHCs and health organizations, who are credible messengers on the ground. They're serving our residents every single day, and our residents feel comfortable going to these spaces. So we have to continue on that work. We have to be very deliberate in this work and very collaborative as we partner together, because at the end of the day, our responsibility as elected officials and advocates and CEOs is to make sure that we protect our fellow New Yorkers, we provide them with affordable, quality health care, and we make sure that we do our part to educate so many of our residents. So I am proud of this partnership. I did see last week that the U.S. military team was at Coney Island Hospital in Brooklyn, and I said, okay, it's only a matter of time before they get to the Bronx, and I'm so grateful that they are here at North Central Bronx. We need the support, we need the attention, and we need the priority, and thanks to our governor, we are getting it here at North Central. So again, I want to say thank you to everyone, to all of my colleagues in government. Thank you to the military team who is here. Thank you for supporting the Bronx in a major way so that we can save lives and protect our fellow neighbors. I am so honored to next introduce someone who has been a great leader. We've worked with him as the borough president and certainly during my time as a member of the New York City Council. He is our president and CEO of New York City Health and Hospitals. Ladies and gentlemen, Dr. Mitchell Katz.
Thank you so much.
Thank you, Dr.
Thank you
Katz.
so much. I'm so filled with gratitude as I stand here, and I want to start, Governor, when you first became governor, you and I talked, and what you promised is that all of the governor's office would do everything possible to work with us, and that has been absolutely how it has felt. You have hired the smartest leaders, Dr. Mary Bassett, Commissioner Bray, Catherine Garcia, people that we know that really care deeply about New York City, and they've been phenomenal to work with. And we're so grateful to you for, really wanting to work together and to fight this pandemic together. And at every point, you've always been there for us. And we're just incredibly grateful to you for that. And I also wanted to say, as a practicing physician, my patients are suffering from long COVID. They have a lot of respiratory problems, as you're saying. They talk about a brain fog, neurological changes. We're very proud that Health and Hospitals has centers of excellence so that we can take care of them. But I think this is like long COVID. It's going to be a long haul to really healing New York. So thank you, and Congressman, we're so proud that you're here. We're so grateful for the Borough President. We're so grateful to this wonderful department from the Department of Defense here to give us our help. We so much. And my last thank you, of course, is to my doctors, my nurses, my support staff. Governor, these are such amazing people. In March of 2020, this hospital was full of people on ventilators. And who was taking care of the people on ventilators? My midwives. My midwives were the ones in the ICU working the drips. Everybody showed up, everybody came, when everybody else was sort of on their Zoom meetings, in their apartments. It was my nurses, my doctors, my respiratory therapists who came to work. And it was as true, you were raising the issue of snow. I remember on Saturday, appropriately, people said, if you don't have to get out of your house, stay in your house. But of course, my workers came, right? Pat's workers came, Local 37, all of the great union partners, our people came. And those are the kind of people that we appreciate, and I'm so grateful. So with that, I'm going to close us out. Governor, are you going to take the mic for questions?
I'm just going to invite I did make one mistake. We're not always perfect. Pat Kane is not the treasurer, as much as every conversation relates around money with her. So I had this treasurer. Can we get more money? So I'm thinking she must be the treasurer. She is the executive director, and I want to make sure that I acknowledge that as well. And I do want to thank everybody for coming. And we'll take a picture, Pat and George, if you want to come up here. We'll get the picture.
Thank you, Governor. Thank you so much. No, you have a much more speaker support makes it better.
Thank you.